Hi everyone, my name's Cherie Zischke and I'm really delighted to be presenting to you today at the Early Childhood Voices 2022 conference. My presentation is on supporting motor skill development and parent and carer perspectives. I'm a lecturer in physiotherapy at Sturt University. I'm also an adjunct assistant professor at Bond University. And I'm currently completing my PhD in the area of access to paediatric physiotherapy services. The presentation today comes from my PhD and one of the studies that I'm completing within that. I'd like to acknowledge my co-authors and supervisors, Dr. Wayne Hing, Dr. Rodney Pope, Dr. Nikki Milne, and Dr. Alicia Spittle. So as physiotherapists, we're very much interested in motor skills. And as a physiotherapist for children, I'm particularly interested in the ways in which children develop their motor skills. And so when I talk about motor skills, what I mean are the skills that involve mobility and movement. And some of the examples of these motor skills include things like rolling and sitting, crawling, standing, walking, running, jumping, hopping, throwing and catching. So all of those skills where we're using our, I guess, big muscles in order to either move within the community or the society, but also to be able to perform activities and participate in games and those types of things. So what happens when things don't go to plan? So we do know that children will typically kind of reach particular, we call motor milestones at certain times or points in their development. But some children might have difficulty in reaching these, and that can be due to a variety of reasons. And some of those reasons include either the presence of a condition or diagnosis of some sort, which then has an impact on the child's ability to perform those motor skills or learn the motor skills. And then there can also be other factors or environmental factors such as exposure to the particular movement. For instance, children who play on the ground a lot more might develop more of those skills in the positions that they're practicing in compared to children who might be held for longer periods of time. Or there could be a genetic component to it as well. So there are a variety of things, and that's just a few that I've listed there that might impact the way that children can develop their motor skills. So in this particular study, we set out kind of exploring parents' ideas on motor skills and their confidence. So first of all, we know already that parents and carers are experts in their own children, and that generally parents and carers are the first to identify or raise concerns about their child's development. We wanted to know if parents felt confident in their ability to identify issues, particularly with motor development. And then we wanted to find out where carers turn to for support. So what resources are available to them? Do they turn to another person particularly? And if so, who? And then what do parents and carers think about the resources that are available to them? And do they think that these resources are adequate or not? And then finally, we wanted to find out if this was the same across Australia, New Zealand, and the United Kingdom. So in order to do this, we had a cross-sectional survey design where we developed a questionnaire for parents and expectant parents. And so the questionnaire was developed using the Qualtrics platform, and we distributed it via social media and particularly Facebook. We were able to reach a wide audience utilising this way of distribution. We particularly wanted parents and carers or expectant parents or carers to respond, and they needed to have a child aged 0 to 16 or be expecting a child to come into the care in the next 9 months, and they needed to be located in Australia, New Zealand, and the United Kingdom. When the data came in, we analysed it descriptively and we used SPSS software for that. Our study was approved via the Bond University Human Research Ethics Committee. So our results showed that, firstly, we had 623 respondents for our questionnaire, and 98% of those respondents were female. 35% of the respondents were actually expectant parents or carers, so those expecting their first child to come into their care in the next 9 months. And 24.2% of respondents were from Australia, 18.1% were from New Zealand, and 57% were from the United Kingdom. And when you think about the populations of those countries, we felt that that was a pretty good representation of each of those countries given their populations. So when we asked parents or expectant parents about their confidence in identifying difficulties in motor skill development, we found that in Australia, most parents or expectant parents felt pretty confident. So 85% felt confident, with 15% not confident. In New Zealand, we saw a very similar trend, slightly less. So 78% confident versus 22% not confident. And the United Kingdom, again, a very similar trend, 83% felt confident and 17% felt not confident. So overall, on average, around about 80% of those who responded felt pretty confident that they could identify a difficulty in their child's motor skill development, which was great. When we asked parents who they turned to for support around child development, and do they turn to a person particularly, we had around about, on average, 50% of parents who said they did turn to somebody else, and obviously 50% who said that they didn't turn to anybody else. And in of the 3 countries, it was interesting, the United Kingdom, we only had about 35% of respondents who said that they actually do turn to another person for support on child development. When we asked parents who they turned to, and we had a particular list of health professionals that they could choose from, this is what their responses were. So we had, in Australia, 33.1% of responses were that parents turned firstly to a child health nurse, followed very closely by a physiotherapist at 24.5%. In New Zealand, the highest number of respondents actually were for the other category. So that included, you know, friends or family, another parent that they might turn to, a childhood teacher, those types of people in people's lives. And so a larger proportion of the respondents said that they would turn there for support, closely followed by a child health nurse. And then in the United Kingdom, we saw a similar thing where 18.9% would turn to those in the other category, so friends and family, etc., and 12.4% would turn to a child health nurse. So when we asked parents if they thought that the resources available to them were adequate, we had around about 50% on average that said yes, they thought that these were adequate, and there was a combined 50% where parents either said no, they weren't adequate, or they were unsure if the resources were adequate or not. And so that was a really interesting result from our survey, and something that I think that we need to kind of consider a little bit more in terms of, you know, what is available to parents, and can they access these in a timely kind of way, and do they feel like they're being heard when they do access these resources. When we had a look and did a bit of a content analysis of parents' responses to this question about the resources being adequate or not, this is some of the things that parents had to say about that. So firstly, no. So when we're asking them, are these resources adequate? So this parent said no. We only have the services available, limited appointments, ongoing staffing issues, expensive. Another parent said yes, they are adequate, but long waiting lists and easily dismissed. Another parent, the resources are available, but may not be easily accessible for families in need. There are a lot of services, but parents rarely know they are available. Yes, but you have to be proactive and realise there's an issue. If you seek them out and they are staffed at capacity, yes. Yes, but often you're made feel like you're being a neurotic first-time mum. They need to be more advertised. And yes, although stretched thin. So a variety of responses there, and seemingly some kind of key issues that are coming out. And this was across the 3 countries. So whilst some of the services are there and they might be available, if they're not staffed at capacity or they've got long wait lists, that is a big issue. The other issue is parents knowing what they can access and knowing where they can access those services is a very important part of the puzzle here. And then also parents' feelings of being heard once they do access those services was also a bit of a theme that kind of came out in this particular study. So overall, based on the results I've provided today, some key impressions. So firstly, most parents and carers felt confident in being able to identify if their child needed support with their motor development, so about 80%. That still leaves 20% of parents, though, who don't feel confident with that, and that's important for us not to forget about that 20%. We had less than half of all respondents reported receiving any support or education about child development from a healthcare worker. And so we can see parents turning to other people for support, and that's important for us to be aware of. And I guess thinking about the reasons that people turn to certain people for support can be due to those access issues or knowing what's available as well, or feeling heard once they do access those things. Half of all respondents believed that the services were adequate to them, but that also left half that either didn't feel they were adequate or were unsure about them. And we found similar results across Australia, New Zealand, and the United Kingdom. So overall, further work does need to be done by healthcare providers to ensure that parents and carers have timely access to information and services about child development, and most importantly, know where they can access these. So just in summing up, our takeaway messages from this research are that parents and carers feel confident in identifying if they need support. However, access issues are problematic for them, and this appears to be the case across Australia, New Zealand, and the United Kingdom. And with many parents or carers reporting issues of inadequacy in timely access to support and information from health professionals, further work does need to be done in this space to improve service awareness and delivery of those services to parents and carers and their children. And we need to do further research in this area. Thanks so much for listening to my presentation today. Bye.